Let's go on the record. Do you snore, or do you know somebody who does? What if I told you that the way that you're breathing right now could be silently reshaping your face? It could be altering your posture, draining your energy, and even affecting your brain health. And you might have no idea that it's even happening. Today we're going to be going on the record about one of the most overlooked habits that is destroying people's health, and that is mouth breathing. Now, in another life, before I retired from dentistry, I also earned a degree in orofacial myology. An orofacial myologist, you may be like, what is that? Well, this is somebody who specializes in the muscles of the face, the mouth, and tongue functions. So we go into depth on how retraining these muscles can actually improve your breathing, your chewing, your swallowing, your speech, and even your overall health. Today, I am joined by one of my closest friends in the world, Dr. Melanie Silvestrini, or Dr. Mel, who is a doctor of dental surgery. She is a specialist in implantology, and she has seen firsthand how something as simple as the way that we breathe can change absolutely everything, not just our teeth, but our entire bodies. We are today going to connect the dots that most people never link together, and by the end of this, you will never look at breathing the same again. Every single breath that you take through your mouth is changing your body's chemistry, your jaw structure, and your brain function even while you sleep. So Dr. Mel, thank you for being here.
Of course, thank you for the beautiful introduction.
It's funny, we have these conversations a lot, so it's actually kind of fun to have them on camera.
Yeah, I can't wait to talk more about it.
So I think we should just start like really top level. This is something that you're really, really passionate about, mouth breathing. And it's funny, like as a doctor, as a dentist, it's not something that a lot of people are talking about right now.
Right. So nasal breathing is often very overlooked, and it's systemic. So dentists are often the first line of defense to really detect these issues in patients. And we should have connections with other specialists as well. So this can begin as early childhood development, and it's often misdiagnosed as well, especially in schools. I would say that the tongue posture is nature's orthodontic appliance, and it really truly does shape the way that our jaw structure also grows when we're at a young age.
Yeah.
So again, there's so much to talk about with it. I mean, I know that with orofacial myology, that's something that you train. So the tongue posture really is important because we want it to be at the roof of the mouth. Whenever the tongue is at the base of the mouth with mouth breathers, it actually causes the lower third of the face to actually elongate, and that causes a narrow palate. And in addition, that creates some malocclusion issues with young children who end up having issues with their teeth being crowded, when in reality that could have actually been prevented a long time ago.
And there's so many other things that affects as well, from dry mouth, like it can give you obviously dry mouth, bad breath.
Exactly, halitosis.
Increases your rates of decay. Like people don't know, and it's funny, it's like you go to the dentist and it's like they'll treat the problem, but they're not getting to the root of the problem. Like, why is this happening again and again and again?
Right. So nasal breathing is one of the most important parts of really detecting early on if a patient is snoring. You have to ask the patient also what their habits are. Now, a lot of patients have no idea what's going on in their mouth, nor if they're sleeping with their mouth open, if they're snoring. So what I do as part of my clinical detection, I check for early signs of wear on the teeth. Once you see that there's some wear on the teeth already, my antennas go up as a doctor, and I'm thinking, okay, so what is causing this parafunctional habit?
So can you explain just for people watching, what is wear on the teeth?
Yeah, so basically it's loss of vertical height of the tooth structure. So you're losing your enamel, and it's like exposing. Exactly. So when your teeth are grinding together, you're actually losing part of the enamel that's supporting the tooth. We're losing that height. And in addition to that, we're causing issues with the entire bite. So what happens as a result of nocturnal bruxism, which is mouth grinding, the lower jaw shifts forward. And the reason why it does that at night is because our body is going into defense mode, and we're trying to open our airway. So a lot of the times when we have signs of wear in our teeth, it's actually an indication that there's something systemic going on with our breathing. We're not getting enough oxygen into our bodies. Another very important fact about nasal breathing is that it allows us to produce nitric oxide. that's nature's performance enzyme per se. So we really need nitric oxide for many things. And it's actually created by our paranasal sinuses, so right here. So when we're nasal breathing, we are generating nitric oxide, which allows for our blood vessels, especially in our respiratory tract, to start to dilate. So now we're allowing for more oxygen to flow in our respiratory system. And a result of that is more oxygen intake. So there's so many benefits to breathing with your nose. So I know a lot of things are going on with mouth taping, and I would love to speak on that because it's not for everyone, but it can offer a great solution to patients who have issues breathing with their nose. And this is where someone like you would train them to properly do this during the daytime and then so on at night.
And it's crazy because when you're actually mouth breathing, it's decreasing the nitric oxide intake by up to 200%.
Yes.
That number is incredible. And it's interesting, you know, I grew up in the dental field. My dad was a dentist. Like since a young age, I was in that area. I had worked as a dental assistant with a specialist orthodontist. I had always been in the field. And this is never anything I had heard people talk about.
Right.
And my dad was like really into functional medicine and to the body as a system.
Exactly.
And he was like, Rob, like let's do this course. Like let's lean into this. And it was just incredible because he actually treated my little sister in MyoBrace. Now MyoBrace, it's an appliance that you wear, but it's not made personal for your teeth. Like it is just you wear it every single night and then you do a series of exercises every single day, and you actually reshape the muscles, you retrain the muscles, and you don't have to wear a fixed appliance for the rest of your life. You don't need to wear retainers because your teeth are in the place that they're meant to be in. It's very interesting.
Yeah, we're reverse engineering it. And so once you work on the occlusion, which is the way the teeth fit together like a puzzle, then we can talk about how your tongue posture plays an effect on that. Now we're also preserving the teeth by doing this. And this is something that I think dentistry is shifting more towards. I think that really focusing on the longevity of your teeth and how can we preserve what we have to our best of our abilities. I think that's where dentistry is shifting towards. And it's often overlooked because not a lot of dentists are going through the training that is required. And this is not basic 101 dentistry. Unfortunately, in the curriculum in schools, they touch on it, but they're not diving deep enough into the systemic matters that are very important. Now, you can become a specialist in sleep medicine. I think that's beautiful, but I think every general dentist, especially specialists, they need to have a strong foundation on this because you can detect this within 5 minutes of seeing a patient.
Yeah.
And I know I touched on grinding of the teeth. So that's the first sign, where. But I'm also looking at the tongue. I'm looking at the size of the tongue. I'm looking at the lateral borders of the tongue. If there's scalloping, I know that there's a large tongue size, and we can actually rate that. There's a scale for this, and I know off the top of my head, but I'm looking at their tonsils. So tongue size, scalloping, the lateral border of the tongue, tonsils, all of these are telling me, okay, maybe this patient is a mouth breather. And also, another thing that I noticed is recession, increased recession. Like you said,
recession is the gums going up.
Yep, the gums go up. I know there's a lot of technical terms, so I should probably. I always I'm gonna narrow it down a little bit better, but so recession is basically when the gums start to go down and we're exposing more of the tooth and the root of the tooth, so we're losing attachment on the teeth. So that affects a lot of things with, and it causes inflammation. Yeah, and that's systemic. Inflammation in your mouth is part of inflammation in your whole body. And that links to your cardiovascular system. Everything is connected, and it's so often underlooked. I want to touch on something that you mentioned in the beginning with children, because I just thought of this. So in early development, when the tongue's forming, the teeth are forming, we're starting to get our adult teeth in, and the jaw is forming, the arches are forming. Children who are mouth breathers are often diagnosed for ADHD. And why do you think that is?
Tell the people.
So a main reason why children who mouth breathe are diagnosed with ADHD very early on, misdiagnosed, is because
keyword is misdiagnosed.
Misdiagnosis. It's because they are they're depriving themselves of oxygen, essentially. And what that's causing is signs of sleepiness, drowsiness throughout the day, inability to focus.
Yeah.
So this is where the nitric oxide, as you mentioned, supports cognition. It's because of allowing that oxygen flow in our body.
Yeah.
The way that nitric oxide works systemically in our lungs, in our blood vessels to dilate the blood vessels. So if our cells are not operating at optimum capacity, we're going to have signs of drowsiness and our cognitive function could be impaired. So at a young age, it's very easy to just see a child who is tired all the time, inability to read a book out loud in class and say, hey, this kid definitely has a mental disorder or attention deficit. There's something wrong. So if we're not looking at airway first, we're probably misdiagnosing or not giving the child and their parents the time of day to give them a proper diagnosis.
Yeah. And it's interesting because you've touched on a lot of the internal things that are actually going on, but there's also external things as well, right? Like when you're looking at somebody who is a chronic mouth breather, it's somebody who's often presenting as sick often. I know I actually used to be a mouth breather. I broke my nose a couple of times and I had never talked to my dad about it or anything, but to me it was just normal, right? I would just breathe through my mouth because I actually couldn't breathe through my nose very well.
Yeah.
And I had chronic bags under my eyes. So bags under your eyes is just like a chronic sign. It's very, very common. Often you're seeing like a retrognathic jaw, which is you're seeing a jaw that's like maldeveloped. It hasn't developed all the way forward. And that's obviously from somebody who's at a young age and the habit that hasn't been picked up. Yeah. And there's other signs as well. Can you talk a little bit about those?
Yeah. So the bags under the eyes, dark circles, that's another thing, especially at a young age you can detect.
Yeah.
But when a child has their mouth open at rest.
Yeah.
And that's another thing I can detect.
This.
Exactly.
Yeah.
So what you'll notice is that lower third or lower half of the face appears elongated. Yeah. When in reality, if they had a normal skeletal development and didn't have an airway issue, they would have a lower and more proportionate lower third of their face. And then the palate, the size of a palate, if it's very narrow, that also affects the way that the teeth fit and arch. So we often have children with overbites, and their teeth will be flared forward. And halitosis, that's another thing. I've had many patients.
That's a fancy word for bad breath.
Bad breath, yes. So halitosis, that is such a hot topic because people ask me all the time, my patients, even their children, they ask about their children. My son, he does all the right things, but his breath, it's horrible. What do I do, doctor? And the child's like right there listening. And I'm like, this is just very, very proper. But anyways, I tell the parent, so how is their sleeping?
Yeah.
Because if we are altering the oral microbiome in our mouth, we're affecting the natural buffer that we need in our mouth, in our saliva. And that pH, once that pH balance goes off, that bad bacteria starts spitting out acid, and it's creating a nice area for those bad breath bacteria to now replicate, and they're spitting out sulfur compounds, and those are the compounds that actually cause bad breath.
Yeah. Again, it's because the body was designed as nasal breathing to be the first line of defense. So you're kind of skipping past that. And you also now that breath that you're breathing in is going to the tonsils and it's going to the adenoids.
Exactly.
And again, it's causing increased instances of sickness and tonsil stones. Tonsil stones is another very interesting one. Again, another cause of bad breath. But I just wanted to touch on one more thing on the external.
Sure.
The mouth breathing actually causes a forward head posture as well, by
slumping.
up to 30%.
Yep, slouching.
And it's going to be interesting, I think, as we're seeing these kids being raised up. This called the iPad generation, right? The iPad generation.
They're already hunched over.
They're sitting down hunched over. So in my opinion, this is something that is going to get worse.
It's going to get worse
and worse and worse. And I think, our heart is that the dental schools, the dental industry, start to talk about this.
Yeah, they have to. They have to. Not only for patients, but dentists are already straining their necks and their backs. And if you're a dental student, you're going to school, you're paying all this money for education, and they're not teaching you about the basics of nasal breathing and airway and how it affects your overall oral health, you're actually not able to understand potentially if you have a mouth breathing problem. In addition to that slouch that you're getting from that posture, you're also a dentist. So you're worsening your posture even more. So imagine that situation. So there's many benefits to spreading knowledge on this and reminding dentists that it only takes a few minutes to properly diagnose this whenever you're meeting a patient.
So let's say someone's at home and they're like, oh, wow, I have dark rings, I'm tired, my lips are chapped, and my mouth breathing.
Yep.
What is something that they can do to kind of figure out if that's a habit that they're doing?
Yeah. So the first thing you want to do is you obviously want to see a dental professional who is hopefully trained to look at your airway and look at your teeth and do a proper comprehensive evaluation. We have to look at everything, especially first visit. So once we look at everything and the dentist says, hey, you have signs of wear, that's an example of, okay, maybe there's something going on with airway. Number two, what you can do is try to train yourself during the daytime to constantly breathe through your nose. See if that becomes an issue for you. You can even do this before your dental visit. Just train yourself to breathe through your nose. If it is a problem and you often find yourself at rest with your mouth open, and ask your friends, they'll tell you, that's a sign that you are having difficulty breathing through your nose. What you could do first, and this is actually after seeing a dentist, you can try mouth tape, but I recommend trying it during the daytime first because it's not for everyone. If you are properly breathing with your nose and mouth the way that you should, mouth tape is not for you, and it could actually cause some harm actually at nighttime when you're using it. So that's number one, but do that with oversight from a dental professional. Now, if the dental professional is able to properly diagnose that you have an issue with your sleep and hence it's affecting your dentition, your teeth, then they can refer you to get a sleep study. And I do this as much as I can when needed. This is usually when there are obvious signs.
Can you explain for people watching maybe what a sleep study is? And obviously, like, that's something that is often prescribed, especially if you know that you snore.
Correct.
Or if you have a partner who reports that you snore.
Correct.
So what is a sleep study?
So a sleep study is essentially for a sleep study is essentially for detecting sleep apnea. Sleep apnea is one of the more serious issues of inability to breathe through your nose that becomes a more systemic problem that causes periodontal disease and cardiovascular effects. So what you do is you wear an appliance at night, and we actually are able to detect and measure your sleep cycle and your ability to bring oxygen in through your nose. So there are mathematics to this, and essentially that data is then transferred to the dentist and then to a sleep specialist, and then we're able to actually diagnose you with sleep apnea. And then if you are properly diagnosed, then you would get an appliance that is custom made to you, and you can wear it at nighttime to support this.
So let's just say someone's at home, they've opened their TikTok, and you know what it's like. You open TikTok and all of a sudden you've got narcissism, you've probably you've diagnosed with ADHD. Now you're like, oh, I'm a mouth breather, and that makes sense why I'm tired and all the things.
Right.
You don't recommend that they first just go out and buy them the tape and try it. You recommend that they go speak with a professional. Share the symptoms that they're walking through and actually try to treat it, like not just the one problem, but understand like this is something that affects every area of your body.
Yes. And I want to highlight this because if you're a dentist in this age, 2025, we're shifting towards branding and really dentists becoming more spokespeople and professionals that are sharing knowledge to media, to the public. So I think it's also fair to say that it's important for you to feel comfortable actually reaching out to a provider. Because sometimes you can build a connection and see, hey, this dentist is knowledgeable about this, and I feel comfortable actually reaching out to them. Sometimes the dentist will be able to just tell you, hey, I think that I should refer you here, or I'm happy to answer this simple question. Social media is very powerful. And I think dentists need to be using it more for this type of stuff.
I think another interesting thing is, I love what you said about referrals.
Yeah.
Because sometimes it's not just a simple mouth tape issue. Like sometimes you need to go see an ENT, right? So there may be an issue
Deviated septum.
Exactly. In my case, like I ironic that the way that my broken nose got fixed was that I broke it again, and it re-broke into in a better position, so I was better able to breathe. But deviated septum, enlarged tonsils, or even allergies can cause it as well. So for some people, it can also be seasonal,
right?
And even I think as well during periods of chronic stress, it can worsen.
That's right.
And also from drinking alcohol. Like there's a lot of things that can
your sleep
trigger
cycle.
this.
That's right. That's so right. And I'm a proponent. I wear my ring. I wear, we have these apps that we can use to help track our sleep cycle. And I think that's also very important because it's so widely accessible now. And if you're not entering your proper cycles of sleep and REM for appropriate durations for health and longevity, that's another indication that something's going on. And if this is recurrent, that's when you can raise a red flag.
Yeah.
But a night of alcohol can cause a horrible REM cycle and temporarily affect your sleep for sure.
Yeah.
Yeah.
So nitric oxide from nasal breathing boosts oxygen delivery.
Right.
It lowers your blood pressure and it improves endurance. So my question is this: why do you think that this isn't something that is being talked about more, not only within the fitness space, but also within the health space?
Yep. Because in the health space, we're talking about performance recovery. So nitric oxide is actually in a lot of pre-workout drinks. But medical professionals aren't really using these terms because it's not sexy. And also, it probably doesn't make sense to patients. But the reality is, with social media and where things are evolving, patients are becoming more informed and they're getting informed by people who are not holding the degrees and the credibility to truly give the right information. So nothing bad about TikTok. There's great people giving great advice there with credibility, but
we call them TikTok psychologists. They want to psychoanalyze everything. You're like, okay, that's interesting.
Yeah, and so we can't
take it with a grain of salt.
Yeah, I think we're not valuing, as medical professionals, we're not properly showcasing our knowledge to a wider public and using these terms. It's as simple as nitric oxide. Someone can definitely remember nitric oxide. But it's being able to display it also in plain terms, but we shouldn't shy away from using the actual terminology. If we're able to explain it properly, a patient's going to remember it, and it's going to hold more impact. And people will share your video, and it's going to just, hopefully this gets out to a lot of people, and they're able to remember, hey, nitric oxide, pre-workout, nasal breathing, I need that. That's why I have to breathe through my nose. And that's why also breath work and meditation, it teaches you how to relax your nervous system. So those things go hand in hand. It's all nasal breathing has a lot of benefits.
I think it's also a habit. I think like my hope out of this podcast is that people realize that, yes, in many cases you may need to be referred to an ENT if it's something deeper, but in many instances it's just a habit. We've formed the habit of breathing through our mouths just simply because we don't know better.
Right.
And I think once you're aware that this is causing so many issues, right, from the malformation of jaw, like crowded teeth, bad breath, ADHD, misdiagnoses, all of these things, snoring. When you realize how deep it goes, then you can try to implement different habits, right? So just something as simple as, all right, tongue to the roof of my mouth and breathe through my nose. And it's just going to have to be an every single day habit.
Let's try it. I mean, does my face look more attractive? Now let's do mouth breathing. So like I said earlier, when we mouth breathe, our jaw shifts forward because we're increasing our airway space. Yeah. Our body does it as a defense mechanism. Yeah. So around like this.
Yeah.
How do I look?
Beautiful.
I only did that for you guys. Okay? Whoever's watching this is for you to remember, but please don't use it as blackmail. Okay. You can cut this out too.
I have to use that. It's so good.
It
makes a difference. It makes a difference.
Remember that next time, and share it with your friend.
Yeah.
This is it's a shame. I have to say it's a shame.
It is.
It's not taught enough in dental school.
Yeah.
It's not.
No.
No. No one's graduating right now and they're thinking about, how do I look at your sleep habits? How do I understand your airway space and how does it affect your dentition and this and that?
It's interesting. And I said this to you. In the town where I was practicing, I had only been graduated for 5 years. And I took on this, on the patients for like the orofacial myology patients, and I loved it. It was, to me, really fun. And it was also rewarding that you could actually see the change in people. Yeah. Like you could see it progressively, right? So I was getting referrals from people that had been in practice 15, 20, 30 years. And to me, like, that was interesting because I was like somewhat of a new grad, but I was like on fire. I loved it, but it just wasn't something that was being talked about. And now it's like fast forward another 5 years, it still isn't. So I love your messaging. If you could leave the viewers with one piece of advice after all of this, what would that be?
Stop being afraid of your dentist. It's time to find a dentist that you trust, one that you align with. Do your research, but don't be afraid of going, because when you find the right dentist, it's actually going to pay you back in so many beautiful ways. And I think that having a beautiful smile, healthy teeth is really important, and it's going to continue to affect our overall health. So don't be afraid of the dentist. That's my one piece of advice, because I'm tired of hearing it.
So she's not kidding at all. So for people watching this, Mel, can you tell them where they can find you?
Yes. Best place to find me, and if you have any questions about airway, I'm happy to help, on Instagram at Melanie Rosalia.
Well, thank you so much for sitting down with me.
Of course.
This is fun.
Yeah.
I love these topics. Now it is your turn to go on the records, friends. So comment below. Let me know about this topic. Is this something that you've ever personally dealt with? Do you have any thoughts? Has your dentist ever talked to you about this? And if you have any questions, let us know. We can get Dr. Mel back on the podcast and answer some of the hard-hitting ones. I know one that I've seen you guys ask about is root canals. So we can definitely get into that in the future. And I will see you guys next week. By the way, guys, we are launching an exclusive monthly newsletter. So if you'd like to receive that, join the family, join the fun, click the link down below to sign up. There is some really exciting stuff that we have coming up, and I want you to be the first to know about it. And on top of that, we're also giving away a pair of Lumia label glasses, the blue light glasses that we've been talking about. And I'm really excited for you to get your hands on them. That competition is going to end at the end of September. I'll see you at the next episode.